You're probably disciplined. Maybe you're praying for healing and you're taking the medications that your doctor's been prescribing to you. But deep down, it might feel like there is something missing. And this is what I learned recently, that medications solve the problem of high blood sugar, but they don't solve the problem of high insulin. And we know that when your body is loaded with this chemical called insulin, your appetite stays high, you never feel full, and every calorie that you eat converts to fat. And a lot of diabetics solve high blood sugar with medication, but they don't solve high insulin. And this becomes problematic because they think that their blood sugar is in order and that everything is alright and that they are progressing. And then they start to slip. They start to think, things are okay. But they're not seeing this underlying root problem, which is high insulin. So the best thing that you can do for combating high insulin is to swap your primary fuel source, the primary source of energy that your body uses as fuel. So instead of eating a lot of carbs for energy, which keeps your insulin super high, and this causes all those cravings, it causes all the damage that you see because having high insulin in your blood is acidic to the body, and it can cause neuropathy, and it can cause decay in your organs in your body. So instead of eating carbs which keep your insulin super high, something like fat and fiber and protein, those types of macronutrients in food keep your insulin a lot lower. And that's why I constantly stress that calories and calories are not the same thing. If you have 1,000 calories of carbs, it's going to affect your insulin and your blood sugar very differently to 1,000 calories of protein, fat, and fiber. So please eat smart, because some of these fat loss coaches who tell you to focus on calories are too smart for their own good. And that advice just does not work for someone who wants to be healthy.